biomedical electronic.
Assalamualaikum and hello everyone. Today, me and my friends gonna tell you guys about Crohn's disease. Okay, my name is Afika and as you guys can see, my other two friends are Alia and Aisha. Let me tell you guys what is Crohn's disease. Crohn's disease is a type of inflammatory bowel disease, which is IBD, that can cause our digestive tract to become swollen and irritated. Crohn's disease also a long-term inflammation in our intestines. It usually affects small intestine, but it can affect large intestine or both the small and large intestines. The system affected by Crohn's disease are small intestine and large intestines. For the small intestine, it can be swelling and inflammation in our small intestine, which is ileum. It also can affect our patchy area of inflammation in the upper half of our small intestine, which called jejunitis. For the large intestine, it can be inflammation in the lining of our large intestine, which is colitis. For the ileocolitis is the common type of Crohn's disease, which is it can be inflammation in our lower small intestine and part of the large intestine. Next is the symptoms of the Crohn's disease. If we have Crohn's disease, we can get fever and fatigue, stomach pain, vomiting, and mouth ulcers.
Risk factors. Crohn's is an autoimmune condition. The immune system operates to bacteria or virus in the gastrointestinal tract. While attempting to fight this organism, it also attacks healthy cells, causing chronic inflammation. The first is include age. People of any age can get Crohn's. The second is family members. People who have a parent, siblings or child with Crohn's are at the greater risk of developing the disease. As many as 1 in 5 people, 20% with the disease. That is environmental factor. And the last is smoking. People who smoke are at greater risk for Crohn's.
Okay, next we will go to the causes of the Crohn's disease. First causes is genetics. There is evidence to suggest that genetics play a role in the development of Crohn's disease. Individuals with a family history of the condition are at a higher risk of developing it themselves. The second causes is immune system dysfunction. It is thought that Crohn's disease may occur when the body's immune system mistakenly attacks healthy cells in the gastrointestinal tract, leading to inflammation and tissue damage. The third causes is smoking. Smoking has been identified as a significant risk factor for Crohn's disease. It not only increases the risk of developing the disease but also exacerbates its symptoms and can lead to more severe complications. And the last causes is autoimmune factors. While Crohn's disease is not classified as an autoimmune disease, there is evidence to suggest that autoimmune mechanisms may contribute to its development. In autoimmune disease, the immune system mistakenly attacks the body's own tissues, leading to inflammation and damage.
The procedure. If medication are not enough, doctor may recommend other procedure to control Crohn's and treat complication. The first is bowel rest. Bowel rest envelopes not eating or drinking for several days or longer. This gives the intestine a chance to heal. Make sure we get the nutrient through a feeding tube. Last is surgery. Surgery is not a cure for Crohn's, but it may be necessary to treat complication.
In conclusion, Crohn's disease is a multifaceted condition that significantly affects the life of those diagnosed with it. Its unpredictable nature, ranging from mild to severe symptoms, challenge patients both physically and emotionally. The chronic inflammation characteristic of Crohn's can lead to a variety of complications and significantly impair quality of life.
Hello, I am Alamai Sarah binti Roslan. I'm Nura Afika binti Khairul.
And I'm Lina Aisha binti Roshanidi.
We are students in Biomedical Electronic Engineering, Radiology and Imaging from KKTM Leda.